fourth time this year. Last 3 webinars have been done successfully, and we all get really fruitful information from the experiences of the other regions. And now we're going to learn and to take an idea about the West Africa region experiences and expertise in addiction medicine. We have now 2 speakers today in our webinar. The first speaker will be Professor Moses. Dr. Moses David Audu. Dr. Moses is a professor of psychiatry, University of Jos, Nigeria. He is a consultant psychiatrist in Jos University Teaching Hospital, and he is also the executive director of Quanti Essential Healthcare Center in Jos. And finally, he is the coordinator of West Africa region in ICUDDR. Can you please, Professor Moses, begin with your presentation? And please, if you can have your presentation in 15 minutes, so we can have in the last 10 minutes questions from the whole attendance. Thank you.
Good evening from Nigeria. Can you hear me?
Yes.
Okay. I'm sorry, my system, 2 of them disappointed me. I don't know what's happening today. I had connected earlier, but I just couldn't get through. In my own part of the country, they say my enemies are fighting me. My invisible enemies are fighting me. I don't know. Sorry. Anyway, just by the way. Yes, we're talking about today's our 4th webinar and for West Africa. And I'm presenting with Dr. Olajumoke Koyejo. She will introduce herself when she comes to her turn. Time is of the essence now. And we're talking about collaboration among universities and other organizations in West Africa, what we have done so far, because our system is slightly different from what's obtainable in other countries, even in the West African sub-region. And when I talk about West Africa, I want to apologize that most of the presentation will be what's happening in Nigeria, because as I said in our meeting last week, I don't get the collaboration from other West African countries anymore. You write emails, they don't respond. Even when they respond, they say, you're doing a good job, thank you, but nothing else. And I try to get information from them, but no information is forthcoming. I sent mails, I don't get responses. So most of the presentation here will be, about Nigeria. And interestingly, Nigeria considers about 90% of all the activities in West Africa sub-region because of the population and the number of universities that are available in the country. So as a way of introduction, about a decade ago, there were no academic programs on drug demand reduction in our universities, to the best of my knowledge, because there was no university that certified students in drug demand reduction activities. But I know that in one of the universities in Senegal, they had an addiction program in the university. But I don't know whether they were offering diplomas or they were just training people. But I've tried to reach out to Professor Abuse, but I couldn't get any response from him. Certified programs in substance use were developed in the curricula of West African College of Physicians, Faculty of Psychiatry, and the National Postgraduate Medical College of Nigeria, Faculty of Psychiatry. They were developed as subspecialties, and hitherto, most of the addiction services were provided by psychiatrists. And in our system, Nigeria trains postgraduate doctors in established postgraduate medical colleges. One is the National Postgraduate Medical College of Nigeria, and then we have the West African Postgraduate Medical College. This is where these specialists or postgraduate doctors are trained mainly, and the curriculum involves both clinical and academic work. So, and usually for you to qualify as a psychiatrist, either from the National Postgraduate Medical College or the West African College of Physicians, which are similar uh, in their curriculum, it takes about 6 years. You are given 6 years to do the training at different stages. So these were the colleges that were training specialists in the field of addiction. So about 10 years ago, they were able to uh, develop subspecialties specifically, in addiction and other subspecialties as well. Apart from general psychiatry, you have addiction psychiatry, then child and adolescent psychiatry, psychiatry of latter life, forensic, so on and so forth. So the forensic curriculum is wide, and if you subspecialize, then you can be fully certified as an addiction specialist. So these were uh, the colleges that were doing training in addiction, before the advent of uh, ICUDDR, or before ICUDDR came to Nigeria, or before Nigeria joined ICUDDR. Most of the work was done by the postgraduate medical colleges. Excuse me. So most of the work was done by these postgraduate medical colleges. Sorry, my system is not responding. But when ICDDR, when Nigerian universities joined ICDDR, and Colombo Plan came from uh, the Colombo Plan, UTC, and UPC programs. Interest was generated in developing academic programs in our universities and colleges. So we now trained personnel in this or faculty staff in ICDDR programs, and we also had program for the UNODC, and we tried to develop uh, drug demand reduction services in our universities, uh, and try to also incorporate some of the uh, programs or some of the curriculum in ICDDR and UNC into our own colleges. But as I said, as it is now, only 3 universities, to the best of my knowledge, in Nigeria have addiction programs, and the rest are still in the pipeline and waiting accreditation from the national body, which is the National Universities Commission. But some other universities, like the Niger Delta University, the Namdi Azikiwe University in Oka, and Nasra State University, have gone ahead to develop uh, curriculum in addition programs. But I'm not sure they have started running them as of now. So these are the universities that have actually established or accredited programs in drug demand reduction in our own country. So the collaboration now is in three forms. One is within the university system, and the other one is between universities, and the third one is between universities and other organizations like ICDDR, UNODC, and Colombo Plan, and so on and so forth. So I would talk about the collaboration and partnership within universities. For instance, we have come up with a curriculum in our university that is awaiting accreditation from the National University Commission, which is the regulatory body. And in our curriculum, we want to uh, mount a program on a master's in addiction science, because when we interview people and try to do some form of needs assessment, we discover that most people will be interested in master's program because they do some form of training in addiction, and the Colombo plan is there, the UNDC program is there, so they will prepare something a bit higher. So in our own university, the Department of Psychiatry, University of Jos, Department of Psychology, Department of Sociology, particularly the social work aspect, public health, came together to design a curriculum in addiction science. And what we want to do is that we want addiction to be a multidisciplinary field, and we want to domicile it at the moment in the Department of Psychiatry because it has more structures and resources for now before a separate or center for addiction studies is established, and we have been able to meet the university authorities and we discuss this with them and there is support, but it's still in the pipeline. So this is a collaboration uh, within the university. It has never happened because most programs are not run that way in the university. But this is the first time that we are collaborating, with different departments to establish a particular program in addiction science. Then we have the other form of partnership is collaboration and partnership that exists between universities. For instance, when we are drafting our own program, our curriculum in addiction science, we collaborated with the University of Lagos or Lagos State University in this curriculum. Uh, Professor Bola Ola was very much um, instrumental to develop to this partnership. So we collaborated and developed the program that is currently awaiting accreditation. And I know that some other universities too are doing that. For instance, the Bayero University Kano is also trying to collaborate in developing addition program, while the University of Port Harcourt too is in the process. And we think that the collaboration will help us better to get the program, going. And there is also collaboration among universities, like as I said, the University of Jos in Nigeria and Lagos State University. Sorry. The third partnership is collaboration and partnership. In this, we're talking about collaboration between the university system and other organizations. For instance, the establishment of the addiction program in Niger Delta was as a result of a course called by the Nigerian Drug Law Enforcement Agency. And they collaborated in doing so many programs on drug demand reduction and workshop conferences. And as a result of that, it paved the way for the uh, development of the program in Niger Delta University. And Dr. Francis Chia was very key in assisting and very much instrumental to the development of the program in Niger Delta University. And other collaborations too came up with the advent of the Colombo Plan, uh, which was introduced by Dr. Olajumoke Koyejo in Nigeria. There are so many programs, particularly the UTC and the UPC programs, which train so many people. So I will allow Dr. Koyejo to introduce herself and to talk about these trainings and collaboration, because she is the one that has trained the most people or most practitioners and even academics on the Colombo plan. So, Dr. Ms. Koyejo, please go ahead.
Can I just take a second to introduce Dr. Nyoki? Dr. Koyejo. Now the second speaker. Now the second speaker is Dr. Olajumoke Koyejo. Dr.
Yes.
Koyejo is a consultant addiction psychiatrist working with Federal Neuropsychiatric Hospital in Yaba, Lagos, and she has a master's in public health, an international certified addiction professional and she was sharing in the training over 650 professionals at different levels of the university treatment course. Please begin, Dr. Koyejo.
Thank you very much, Koyejo. Thank you very much, Prof, for sharing this platform with me. Mr. Samuel, can you please? No, continue.
You continue.
Continue sharing. Yeah, okay, yes. So we're going to be talking about collaborations with universities and organizations. Well, before the advent of universities offering addiction programs, we've always been treating patients and we've been training in some ways. And the UNODC, United Nations Office on Drug and Crimes, brought treatment services in which we were trained across board on how to treat our patients. In 2017, Colombo Plan program came, in which we started training people in universal treatment course and universal prevention curriculum too. The Nigerian Drug Law Enforcement Agency are also other organizations universities are partnering with now. And now we have the ICUDDR and even International Society of Substance Use Professionals. Universities are partnering with them. In the UT, next slide, please. Before the Colombo Plan came in 2017, United Nations Office on Drug and Crime had made some organizations, tertiary treatment centers, and one private mental health clinic in Nigeria, model treatment centers. And these are organizations that give evidence-based treatment services. And this includes teaching hospitals, research centers, and treatment centers. Next slide, please. So what is the nature of this collaboration? Well, my own organization, which is Federal Neuropsychiatric Hospital, Yaba, Lagos. We were the first model treatment education provider for Colombo Plan. So we started organizing trainings for UTC 1 to 8. We were organizing trainings and workshops, in which we professionals across board were trained. Other nature of collaboration is even in curriculum development, exchange of lecturers, internship. Federal Neuropsychiatric Hospital Yaba provides internship facilities for doctors in trainings and even other staff. We are into research and we support other organizations in helping them train their staff. So, like now, we have a psychiatrist, university professionals, which are different stages of the treatment course. And these professionals are from different organizations across Nigeria. So you can see the collaboration of our course between the university system and organizations that are non-academic, they're just treatment centers in Nigeria. Next slide. So what are the reasons for collaboration? Is to bridge manpower gap, provide institutions with research funds and offer students job opportunities, and most essentially to build capacity. Like I said, before now, we've always been treating addiction services. Is it evidence-based? Before UNODC came, what we're doing then, was it evidence-based? Of course, UNODC came and gave us more evidence-based practices, which upgraded our the services we render to patients in our facilities. When UNODC came and when Colombo Plan came, there was promotion of innovation and improvement in prevention and treatment services. Now, Colombo Plan is even, we have treatments about adolescent professionals in addiction professionals. We have the recovery curriculum. So there's a lot of improvement in prevention and treatment. Of course, it would attract research and funding because now we are seeing things that are novel to us. So we are applying for grants, training and support organizations for evidence-based practices, and to enable exchange programs. These are the reasons for this collaboration. Now, we tell you that it is paying off in Nigeria. The effect of this collaboration is highly felt among both the academia and other organizations that provide addiction treatment, prevention, or advocacy services. Next slide, please. Next slide. So the benefits, so we experience spaces are shared and capacities are built, services are standardized and evidence-based, sharing costs, risk, and benefits. This is really important, the idea of sharing costs, risk, and benefits. People send their staff to Lagos, about 30 people will be trained at a time, so they don't have to organize their own trainings. So knowledge is imparted and we all benefit. And even experience is shared across board. There's culture sharing collaboration among people from different parts of Nigeria in these trainings. And we've gone as far as even training people outside of Nigeria, West African countries, like in the child program, people came from all over, from Ghana, and even our trainer was from Kenya. So you can see the effect, the benefit of collaboration. It gives universities access to more resources to fund their research and diversify their research areas. Promotion of academic growth and community development. This cannot be overemphasized. And we have the next slide, please. So what are the challenges in this in the field of addiction treatment, prevention, and advocacy? There's lack of manpower. There's lack of funds. Stigma. People still see addiction as a moral deficiency problem. There's conflict between academic staff and regulatory bodies. Like in just now, the Nigeria University Commission is not warming up to accrediting the program fast as quickly as expected. So there's conflicts between academic staff and regulatory bodies in developing content of academic programs in Nigerian universities. Older universities are not so keen in offering courses in drug demand reduction. Next slide. Next slide, please. So what's the way forward? How do we go around these challenges that we have in Nigeria? We're thinking of something like the PASS, International Program in Addiction Studies, what they are doing, in which there's collaboration among foreign universities. You can imagine the Virginia Commonwealth University, University of Adelaide in Australia, King's College in London. They are now collaborating together to offer addiction education professionals. This is something, so our collaboration in Nigeria might be what would actually help us to move forward in this, in capacity building for people that are interested in the field of addiction. And also, of course, there'll be cross-cultural exposure through long-distance learning technologies to the critical prevention, treatment, policy, and research issues. You can imagine all of us all over Nigeria coming together, and through technology, knowledge is being imparted. We have a curriculum, a program in which it's hybrid. We believe that this would help us go around the challenges we have and move the education, evidence-based treatment and education for addiction professionals in Nigeria forward. And we're looking forward more robust discussion in way forward that could be of help to us in Nigeria. Thank you very much. Prof, I think Prof would want to round up to conclude. So Your mic is mute, sir. Prof.
Please proceed, Professor Moses, for conclusion.
Your mic is okay. Unmute your mic, sir.
Okay. Addiction is a multidisciplinary subject, and we cannot actually succeed in mounting addiction programs successfully without collaborating with various professionals in this field. And it has to be interdisciplinary, cross-cultural. We have to collaborate with organizations other than our institutions of learning in order to stimulate research, standardized practice, and give evidence-based treatment services. So this is what the collaboration in West Africa is all about. And for us in Nigeria, as I said, it's a peculiar thing. While the universities are under the Ministry of Education, supervised by the National Universities Commission, the tertiary health institutions are under the Ministry of Health, and the regulator there is the Medical and Dental Council of Nigeria. So there's some form of collaboration among them, but as I said earlier, the health sector has been in the forefront of providing additional services. That's why the disciplines in psychiatry of the two postgraduate colleges, have gone ahead of other institutions to develop certified addiction programs that the universities have not started offering. So that is what we have at the moment. We want to take questions from you. And sorry for the poor connection. You can see I'm using Sam's laptop, not even mine. Thank you.
Thank you so much, Professor Moses, and thank you, Dr. Koyejo, for the fruitful presentation. And now the webinar is open for questions. And I'll see if we have any questions on the messages. No, we still don't have. Yes, Beatrice, can you please proceed?
Thank you, Dr. Rania. I was actually clapping for the team. Can you hear me? I hope.
Yeah,
yes, I was actually giving a clap to the team because that is a wonderful presentation and it is very, very enlightening for me. Thank you very much.
Another clap and a third clap. Thank you very much, our speakers. Any questions or query or commenting? And a third and a fourth and a fifth and a sixth clap. Very good.
Don't finish.
7. Any questions or comment, dear attendants?
If you don't have questions, then I have for you.
Go ahead, Professor Moses, and ask
Yes.
Dr. Koyejo.
Does any country operate the kind of system we operate in Nigeria? In Africa?
Dr. Moses, your question is to whom?
Yes, I said, does any country in Africa operate the kind of system we operate in Nigeria, whereby you find out that anything to do with postgraduate medical education, particularly development of doctors, is done by separate colleges outside the universities, and it produces most of the academic staff for the universities in medicine. Because if you have to specialize, you don't specialize from the university, you specialize from the postgraduate medical colleges. And they are the forefront of developing anything to do with addiction, subspecialties in medicine, surgery, whatever. But the university can just go and get an MSc academic degree or get a PhD. But for you to specialize, a different body certifies you. Why the universities and the regulatory body certify university curriculum in academic work, research, and so on and so forth. But if it comes to real practice in medicine and specialization, is certified is the postgraduate medical colleges that offer through the teaching hospitals, university teaching hospitals. And the regulator there is the Medical and Data Council of Nigeria. So I say, is there any country that operates this kind of system? And there are two different ministries. Universities under the Ministry of Education, while the postgraduate medical colleges, most of them, work through the Ministry of Health.
Yes.
So if, for instance, myself, I am a lecturer with the university, but I am a consultant to the university teaching hospital, two different bodies, but I work in both. And for you to be able to become an honorary consultant to the university teaching hospital, you must secure an appointment with the university as a lecturer. If you secure an appointment as a lecturer, then the teaching hospital now will offer you the job of an honorary consultant, in that specialty. So does any country in Africa operate our own kind of system?
No, I guess in Egypt, as far as you take the MD, the medical doctorate in addiction psychiatry or public health addictology or any other medical specialty, you can either work out of the university in the other hospitals, even if you're not a university staff.
So who trains this specialist? For instance, you are a psychiatrist, maybe an addiction psychiatrist.
Yes.
The clinical work, who trusts those clinicians? Which body? Is it university or who trains them?
They take their MD from the university, not from the Ministry of Health. And when they go back to the Ministry of Health in the governmental hospitals, in the addiction programs of those hospitals, they are supervised by the mental health secretariat. We have a big body that supervises the psychiatry work in Egypt, called the Mental Health Secretariat. They supervise the performance and they supervise the programs and the operating system in the hospitals and the operating programs in addiction.
So if you want to specialize as a psychiatrist in Egypt, do you
Yes.
now go through the university or you go through the university teaching hospitals?
University.
Which one certifies you as a psychiatrist? Which body? Is it university or the hospitals?
All addiction programs are in the School of Medicine, and the School of Medicine does have a hospital. There is no School of Medicine in Egypt without a hospital. Since it's a School of Medicine, so it has a hospital. We cannot have a School of Medicine without hospital.
Okay. It's okay. Thank you.
I have a question for Moses.
Okay, please, Beatrice.
Thank you. So once again, I am extremely impressed by the collaborations happening in Nigeria. And so my question is, one of the observations I see in our country is that different disciplines like to isolate themselves and work as a silo alone. Psychologists, psychiatrists, social workers, etc. So how have you succeeded in breaking the barriers and bridges and walls and bringing them to work together as a collaborating team and agree on actually having a collaborative program? Thank you.
Thank you very much for this pertinent question. Actually, it has never happened, but I had to lobby. And I have friends and good lecturers in all these different departments that I have collaborated in one way or the other, either through research or workshop, whatever. So I reached out to them and said, this is the in thing now in the world. What's happening now is that addiction is a multidisciplinary field and an entity on itself. And we want to pioneer that in Nigeria through the University of Jos. So can we come together and be the first university to do this, a multidisciplinary field in addiction science? And we have lecturers from psychiatry, your contribution from psychology, sociology, social work, public health, so on and so forth. And I reached out to them, they said that was a good idea. But the issue is funding. And that may not be a priority to the university. Then I went to my head of department and I said, look, we can do this since we have the resources and we have the structures, we have human capacity. can we domicile it in the Department of Psychiatry while the university is thinking of a different structure or center for the addiction studies? So the department met and agreed that yes, we can do that. So we went ahead and then drafted the curriculum with inputs from all the different departments before we forwarded it, to the College of Medicine, and then from there to the University Senate. It was just an act of lobbying, and then we had met with the Vice Chancellor of the university, which is president in some countries, president, but we had met in writing a grant proposal, and then we introduced this idea to him, and it seemed to be in agreement. So it made it easier for us to come together to do this. Otherwise, we wouldn't have succeeded as a department to do that.
And I would like to comment that it's great that you took 10 years to make multiple addiction curriculums in many universities and with many international bodies in Nigeria. Congratulations. It took us in Egypt more than 25 years to do that. And we hope the best for all our regions and universities.
Thank you.
So, dear attendants, any other comments?
I see that Samuel left us a message in the chat asking members to kindly be on standby for a photograph.
Yes. Can all attendants please open your camera for a common photo? So we will take one video and one photo for all of us. Can you please all open your videos? Dear attendants, please open your videos. We will be taking a photo for less than 5 seconds. Thank you. Sapam. Can you open your videos, please?
I don't know what to do.
Okay, I guess we're ready. Who will be taking the photo?
I've been snapping
The
photos.
African
I think
coordinator.
Samuel, did you get what you needed?
Okay. I would love to thank the speakers. Thank you, Dr. Moses, and thank you, Dr. Koyejo, for this very learning and educational presentation and your struggle with the collaboration and building an addiction curriculum treatment. Thank you so much. Thank you for the ICUDDR. Thank you, Carly and Samuel. Samuel is usually our soldier in all of the IT tools in Africa. He's #1 IT tools in Africa for IT now. And thank you, Carly. Thank you, the ICUDDR, and thank all my dear colleagues, coordinators in arranging for this day. And thank you all our African colleagues in all our in our lovely Africa. Thank you so much.
Thank you.
Thank you.
Thank you very much.
Thank you.
Thank you.
Wonderful
Bye-bye.
presentation from Professor Moses and Dr.